What is tendinitis? Tendinitis, also known as tendonitis, is a common musculoskeletal condition characterized by inflammation or irritation of a tendon. Tendinitis is inflammation of the thick fibrous cord that attach muscle to bone. These cords are called tendons. The condition causes pain and tenderness just outside a joint. Tendinitis can occur in any tendon, but it's most common around shoulders, elbows, wrists, knees, and heels. Most tendinitis can be treated with rest, physical therapy, and medicines to reduce pain. Long-lasting tendon inflammation can cause a tendon to tear. A torn tendon might need surgery. Left untreated tendinitis can progress to chronic tendinopathy or tendon rupture.
So moving on to the clinical manifestation of tendinitis. So the most common symptom of the tendinitis is pain at your tendon or the surrounding area, especially when you're moving. And then the second one is stiff joint or difficulty moving your joints. And then the third one is hearing or feeling a cracking or popping sensation, especially when you move. And then the fourth one is swelling. And lastly is weakness at the affected area of your joint.
Conservative management, non-pharmacological medical therapy. Rest protocol. Rest, ice, compression and elevation. First line treatment of tendinitis. Rest, avoiding activity that aggravate the pain. Ice, help reduce swelling and pain. Compression, achieved with bandage or wrap. Elevation, particularly for knee tendonitis, can help reduce swelling. Physical therapy, range of motion exercise and splitting. Reduce inflammation, improve soft tissue, restore function and strength. Focus on eccentric loading to promote healing. Screen for joint mobility deficit may contribute, such as shoulder mobility in tennis. Extracorporeal shock wave therapy (ESWT), non-invasive, promote healing in a chronic tendopathies such as Achilles and plantar fascia. Platelet-rich plasma (PRP) injection, autocoagulant blood product to accelerate a healing. Mixed by promising evidence in refractory cases. Pharmacological treatments (NSAID), such as ibuprofen, naproxen, and diclofenac, reduce inflammation and pain. Oral or topical form are used for a short moderate duration. Acetaminophen, paracetamol, pain relief with anti-inflammatory effect if NSAID are contraindicated. Corticosteroid injection used for severe or persistent inflammations. Common in shoulder, elbow, or wrist tendinitis should be limited due to risk of tendon weakening and rupture. Topical analgesic, diclofenac gel or similar for localized pain relief. Antibiotics are used if infection are suspected in the rare case. Associated with tendinopathies or trauma. Surgical management might be an option if a persistent pain and functional limitation significantly impact daily life. Surgery can be performed using minimally invasive arthroscopic or open surgery depending on the location or severity of tendonitis. Tendon repair. Suturing or reattaching a torn tendon using a suture or other technique. Debridement, removing damaged or inflamed tissue to provide healing. Tendon transfer, reattaching a healthy tendon from another area to replace a damaged tendon in an affected area.
Today I will talk about diagnosis and nursing intervention. The diagnosis is acute pain related to inflammation of the tendon, overuse or strain as evident by verbal report of pain, guiding behavior, limited range of motion, and facial grimacing. The goal is the patient will report a decrease in pain from 7/10 to 3/10 within 48 hours of initiating treatment. The nursing intervention is the first one, assess pain characteristic, location, intensity, duration, and quality every 2 to 4 hours. Rationale untuk frequent assessment help monitor pain progression and effectiveness of intervention and guide timely changes to the care plan. Second, apply cold compress to the affected area for 15 to 20 minutes every 4 to 8 hours as prescribed. Rationale for cold therapies reduce inflammation and numb the area, thereby decreasing pain and swelling. Number 3 is administer prescribed analgesic, for example NSAID, as ordered and monitor for effectiveness and side effect. Rationale NSAID target inflammation and reduce pain. Monitoring ensures safe and effective medication use. Number 4 is educate the patient on activity modification and avoiding overuse of the affected tendon. Rationale, reducing strain allow the inflamed tendon to rest and heal, preventing exacerbation of pain. Lastly is encourage the use of supportive device, for example brace or splint as recommended. Rationale, immobilization reduce movement that could worsen the inflammation or pain, supportive tissue recovery. The evaluation, the patient reported a reduction in pain from 7/10 to 3/10 within 48 hours of treatment initiation, indication the effectiveness of pain management intervention. From the all nursing intervention, the goal was met.